We now welcome Regina Foley, who is Senior Vice President of Integration and Transformation at Hackensack Meridian Health, Ph.D., MBA, and also registered nurse. Do you have any more initials after your name, Regina, that I don't know about?
That's it, Steve.
Yes, and we've known each other a long time and talked about healthcare for a long time, and you've been in some leadership seminars I've done. And the one thing I've always known about you is your commitment to healthcare and taking care of those, particularly in difficult times, is second to none. So in that spirit, let me ask you this. Biggest lesson you've taken from the COVID experience as we enter summer of 2021 is what?
Taking care of yourself and making sure you're maintaining your health, because this virus is insidious, it's nasty, and we've got to do a better job with eradicating it, getting rid of it. So the biggest takeaway was for people to recognize that it's a nasty, ugly virus, and we got to do a better job with making sure we protect ourselves against it.
There's so many ways people have been impacted, and I don't mean just medically or in terms of their health and the loss of so many lives. Emotionally, psychologically, a huge part of this, right?
The impact psychosocially among individuals, I see among the profession, the healthcare providers, nurses and physicians and technicians, for them and their families, the scale has been enormous. And even among our own neighborhoods, those have been impacted by family loss of people, loss of life that we've experienced in the United States.
Yeah, and by the disparities, the healthcare disparities related to COVID, what lessons have we learned? Well, hopefully learn, and moving forward, Regina.
We have got to do a better job with partnering with the Latinx and African American communities and those of color. The communities of color have been 3 times more impacted, twice more to loss of life, and Latino males are right at the top of that list, tragically. We as a country have got to do a better job being proactive, partnering, resources for those, obviously, all things associated with social determinants of health.
You know, a quick follow-up on this. We're taping on May 20th. About a month and a half ago, we had Harry Carson from the New York Giants together with Bob Garrett, your CEO, talking about vaccine awareness and resistance. And Harry Carson, the great all-pro Hall of Fame football player with the New York Giants, happens to be African-American, talks specifically to the African-American community. The resistance, where do we need to be dealing with resistance, particularly in the African-American community, to the vaccines?
Well, we have damage to deal with from decades of not treating everyone equally. And that damage, our memories aren't short there. We have long memories. So again, that's where the better job with African-American communities, really communities of color, whether it's pandemic or even at Hackensack Meridian Health, we're recognizing that social determinants of health is a factor, and we're working hard to change this, addressing issues like housing security. Or
what does that have to, hold on, what does housing have to do with healthcare?
A lot, because if it's that hierarchy, right? If you don't have food and shelter and those primary, you're not mentally able to deal with, how am I supposed to take care of myself? Where am I going to live today? How am I going to get food today? How am I going to be? How do I get the knowledge to be able to treat, to take care of myself? Lack of transportation could be another issue. Financial.
These are social. Sorry for interrupting, Regina. Social determinants of health, correct?
That's correct.
Regina, let me ask you this big picture, because we try not to be timely. You can check out our program, NJ Spotlight News, on NJPBS and also on WNET in New York, for the daily activities going on in the news, as well as Metro Focus. But long-term, big picture, what would you say one of the most significant impacts, if you will, plural, of COVID will be on the larger healthcare community? One huge impact.
Telehealth. Telehealth comes right to the top of the heap for me. That during this time where you weren't able to seek out physicians in an office or go to an office setting, instead of bringing the community to practices or to facilities, we need to go to the communities, and for those that we're serving, telehealth is an easy example. And then the rapidly changing market with urgent care. Urgent care is popping up, more neighborhood-based, locally based, community-based. So to have the provider that's more in your neighborhood, that certainly is one way to go about it. which we're doing nationally. And then secondly is just the ability to have telehealth technology, available to those, so that they can call into an appointment, see a provider, see a nurse practitioner, see a physician, and diagnose and get treatment plans together. That those are two major takeaways that have been from this pandemic.
Before I let you go, Regina, you know nursing better than just about anyone else I know. Do you believe that we had a guest on from another healthcare system who said she believed more nurses were going to be signing up, or more potential nurses signing up? Do you see that trend?
I do see that trend. There's a massive calling for nurses. There aren't enough providers, there aren't enough clinicians nationally. We are seeing a movement, and it has motivated individuals to go into certainly nursing. I'm biased, obviously, Steve, you know my background, a nurse, noble profession, and obviously those with big hearts. But we will see an increase. The challenge we have is, myself included, nurses are aging out nationally. The vast majority of nurses practicing are north of 50 years of age. So therefore, we're going to have to accelerate and do whatever we can do with all these, whether it be generic programs, how to get people to licensure, to encourage them to make programs easily accessible and to give options. So I do think that we will see more nurses in the country on the horizon here.
That's Regina Foley. She knows a lot about healthcare. Thank you, Regina. We appreciate you joining us.
My pleasure, Steve.
I'm Steve Adubato. Stay with us. We'll be right back.
We not only have the
Conference call calamity. You've got an important meeting to talk about next week's pre-meeting. But your Uncle Larry decided to stop by 2 weeks ago. This looks like a job for Smile Power. Good thing you've got access to the nation's largest network of molar-defending dentists for your dental benefits, so you can synergize your team dynamics with a healthy smile. Unleash your Smile Power with Delta Dental. Delta Dental.
Also brought to you by the Turrell Fund, supporting Reimagine Childcare. PNC, Grow Up Great. IBEW Local 102, lighting the path, leading the way. Summit Health, a provider of primary, specialty, and urgent care. NJM Insurance Group, serving New Jersey's drivers, homeowners, and business owners for more than 100 years. Rowan University, the New Jersey Economic Development Authority. Delta Dental of New Jersey. Everyone deserves a healthy smile. And by the Adler Aphasia Center,